Hi guys, and welcome to the channel. Today's video is an important topic. It's about women's heart attacks and the 3 things you can do to protect your health. But before getting started, I'd like to ask you to go ahead and subscribe to the channel. Subscribing costs you absolutely nothing, and it really helps the channel. It allows me to keep creating these Medical Minute episodes for you. Also, when you click the bell, it notifies you when the new video is out. And clicking the like button lets YouTube know I gave you some interesting and valuable content. So please subscribe, like, and give that bell a smash. Thanks. Now let's get it on.
Your body is quite good at letting you know when anything is off. For instance, a cardiac condition affects the nerves there as well as elsewhere, resulting in discomfort. The discomfort or pressure can keep you awake at night and is occasionally abrupt, not brought on by physical effort. You frequently link chest pressure or pain with a heart attack. Women should, nevertheless, be extra alert for any new heart issue symptoms. According to cardiologist Leslie Cho, MD, most women experience the same symptoms as males. Up to 70% of women experience tightness or pressure in their chests. About 30% of women experience unusual symptoms. In this section, Dr. Cho goes through 3 abnormal symptoms to look out for and how to determine the origin of them. Severe tiredness. Like many women, you probably spend most of your time working and taking care of your family. This, unsurprisingly, implies that you're frequently exhausted, which is just normal. Yet heart tiredness is far more severe and incapacitating. Dr. Cho explains, we're not talking about general exhaustion as you feel weary at the end of the day. We're not referring to the fact that you should leave for a nap at 5 o'clock. Instead, this indicates that following your usual workout regimen, you are unexpectedly exhausted. We're talking about the fact that you used to be able to climb a few flights of stairs, and now you can hardly manage one, says Dr. Cho. Maybe you are so exhausted that you can't even climb the stairs. Additional warning signs include being too exhausted from everyday tasks like changing the bed, going to the restroom, or going shopping, as well as feeling fatigued all the time. Breathlessness. Women's steady weight gain and lack of activity as they age contribute to problems including shortness of breath. However, when it occurs in specific circumstances, this might indicate a cardiac condition. You could find that you get really short-tempered when you weren't previously while you're strolling around the block putting your dog out, Dr. Cho explains. You'll get very, very short-tempered walking to your car. Another warning sign of heart failure is shortness of breath that becomes worse while you're laying down but gets better when you're sitting up, as well as dyspnea that gets worse over time following exertion. Another sign is experiencing abrupt shortness of breath when not exercising. 26. The incapacity to do previously performed tasks. Defining this symptom can be somewhat difficult because it's less a universal heart attack sign and more dependent on your individual experiences and baseline energy levels. It's a significant change in your functional status, is how I would put it, says Dr. Cho. You were able to be on the treadmill 20 minutes, but now you can barely do 10 because you just feel so tired. Other potential heart attack signs. Heart attack signs look different for everyone, although there are a few common ones to watch for. Neck, jaw, arm, and back pain. A heart issue may be the cause of pain that spreads to your jaw, back, neck, or arms, particularly if the source is obscure. As an illustration, you could have discomfort without any particular muscle or joint problems. You should also get it looked at if the soreness starts or becomes worse when you are exerting yourself and goes away once you stop doing out. Unexpected perspiration. Many women get hot flashes during the menopause. On the other hand, sudden or heavy sweating that is accompanied by other symptoms like nausea or chest pain can also be a warning of a heart attack. Stress sweat, a chilly, clammy feeling, or sweating or shortness of breath coupled by other symptoms, such exhaustion or chest discomfort, might be grounds for worry. Chest discomfort, although it's a regular heart attack warning sign, chest pain might feel different from what you might expect. According to Dr. Cho, we need to go further into the chest pain symptom for both men and women as it pertains to heart attacks. It is rarely as dramatic as you may anticipate, and it might feel like pressure or heartburn that develops gradually. When should you dial 911 if you have a cardiac condition? There are situations when you really must dial 911 immediately away. Dr. Cho advises patients to see their primary care physician right away if they begin to experience chest tightness or discomfort. Visit the hospital emergency room. If you have chest pain or discomfort combined with any of the following symptoms, especially if they persist for more than 5 minutes, you should phone 911 and seek immediate medical attention. Other upper body pain or discomfort, such as in the arms, left shoulder, back, neck, jaw, or stomach. Breathing problems or shortness of breath. Sweating, including cold sweat. Fullness, nausea, or a sense of choking, may feel like heartburn, sickness or vomiting. Headaches, vertigo, excessive fatigue, or anxiety. Irregular or fast heartbeats. Actions to do in the event of heart attack symptoms. If you believe you may be experiencing heart attack symptoms, and some do occur weeks or months before a heart attack, don't dismiss them out of hand or let them persist for an extended period of time. According to Dr. Cho, women frequently assume it's something else. The unfortunate fact is that women frequently experience more heart blockages when they require medical attention. In actuality, women typically get heart disease later than males. Males develop it in their 50s and 60s, while women develop it in their 60s and 70s, according to Dr. Cho. The influence of estrogen always causes women to get it 10 years later. The sooner you report a problem, the more likely you are to discover it before it develops into a serious heart attack. Make a note of any symptoms you feel, and get in touch with your doctor as soon as you can. It's crucial that you allow someone else be your doctor, rather than being your own, advises Dr. Cho. When should you visit a physician? If something doesn't feel right, it's best to err on the side of caution. You should see your general doctor or your cardiologist if you have observed that you are shortness of breath with frequent exertion, advises Dr. Cho. Whether it started lately or not depends on the intensity and acuteness. When you do go, remember to include a note of your symptoms together with the times when they occur. Inform them of any corresponding family history of heart disease. Discuss your tension or any other issues that may be causing you problems. Your doctor will likely ask you about your symptoms and check your blood pressure and pulse. They could want blood tests to see whether your heart is injured. They could also use an echocardiogram, echo, to evaluate pictures of the heart and determine whether there has been cardiac damage, or an electrocardiogram, EKG, to determine whether the electrical activity of your heart is normal. Some individuals could have cardiac catheterization, coronary computed tomography angiography, CTA, or stress testing. All of this is crucial for finding any issues and taking action to stop a potential heart attack.